Tercjak, and I was doing the medical volunteering in La Ceiba, Honduras from July 27th to August 10 in the clinic and the hospital. The coordination was great. Rafa picked me up right from the airport with a big broader view sign, and on the way to the house we were showing me everything that was close to the house, and when we got through the house I was given dinner and then a city tour. Any of the meals that you have a problem with, or if you have any dietary restrictions, they always accommodate you, and you're given a key to your own room so you feel safe. The most surprising thing that I experienced at the program had to be the lack of supplies. When you get here, you're going to realize that there's nothing. You have to bring everything with you. I brought a little bit of things, and it ran out in one day, which made me think that I could have brought an entire drugstore with me and it would have ran out within the week, because there are no supplies and a lot of the people don't have the means to buy anything. At the accommodation, there's no air conditioning, so expect to get a little bit hot at sometimes, and the power does go out, which can be frustrating, but there's a terrace for all the volunteers to come outside, and there's always a breeze up here, and mosquitoes are everywhere. The most surprising thing about the country is that everybody's friendly. I'm from New York and nobody is friendly at all, so having people say hello to you all the time and smiling at you is something very different, and it makes you feel welcome even with people that you won't ever see again. They'll always be very polite to you. The most difficult thing to experience at the program was the lack of supplies. Sometimes you'll feel really bad that you have to tell people to go to the pharmacy or send their families to go to the pharmacy to buy supplies, because either the clinic doesn't have it, the hospital doesn't have it, and they're not going to provide it to you if you don't have it. Usually they won't use their own supplies, and you have to have the patient go out and buy it, and it breaks your heart a little bit sometimes, but you have to get used to that, and there's nothing that you can really do about it. The most difficult thing at the accommodation is the heat, but within a few days you'll get used to it. I actually brought a small fan with me, which I'm going to leave for a future volunteer. The most surprising thing about the country is the poverty. In some places around La Ceiba you'll see really bad poverty, but it's just the way of the government, and that's how some things are in some places. But a lot of La Ceiba is very, very beautiful and cultural. Some future tips about clothing. I would say it depends how long you're staying, but pack a lot of scrubs. You're going to need clean ones to take to the hospital if you want to see surgeries, and either way, there's no air conditioning in the clinic or in the hospital, so you're going to be sweating a lot. So I would say pack a lot of scrubs, at least 4 or 5 pairs, and don't pack anything that you think, oh, just in case, like long pants or long sleeves, because it's just going to bulk up your suitcase and you're never going to use it because of the heat. And bring clothes to go out in as well, because the nightlife in Ceiba and in Honduras is great. You would have a great time, so don't just bring clothes to go to the clinic. You're going to want to go out too. Donations, I would just say bring anything and everything you can donate, especially gauze. Bug spray also. Bring a lot of bug spray. Something you should know is that you're going to be challenged a lot, especially, it depends on your medical knowledge, because in the clinic, they're going to let you just be on your own and do what you're supposed to do in the clinic, and there's going to be things that you're not going to know how to do, but they will explain to you, and then you're going to have to do it. So, I mean, if you don't feel comfortable, I would say try to step out of your comfort zone, because that's what you came here for. Stepping out of your comfort zone, and you're going to learn a lot, and you'll be able to put that on a resume or something else, and that would look great, because you would never get any of this experience someplace else. Another thing is that sometimes doctors or nurses might do things that are ethically different to what you would think, but you have to accept it because it's the laws of the country and the way that they run things. On the weekends you have your own time, so go out and have fun. I've went rafting, I went to Rio Maria, I went to different rivers, I went to Utila. You can take really great advantage of the 2 tour guides that they have, and they will show you around at a really small price, and at least you'll have a local that you'll feel safe with and you can be going around. My experience was amazing, which I got to know people, I got to know a lot of volunteers and a lot of locals around that will ultimately become your friends for life, and I've experienced so many things that I would have never experienced back in the States, and that will always stay with me, and especially like immersing yourself into the country. And it was very, very helpful that I'm fluent in Spanish, because without that I probably wouldn't have been able to do as much as I could. So I would recommend the immersion classes to volunteers that don't know any Spanish. But even without it, a lot of the other volunteers, they would ask me, or they had the translator there as well, which was really helpful for people that don't know any Spanish, so that you can be a part of what you're supposed to be doing in the clinic. The food was always accommodated to what you wanted to eat. If you had a problem or a dietary restriction, you could just tell Rafa or tell the woman that's cooking, just to tell her if you're a vegetarian, if you're just a pescatarian, if you are a vegan, if you have any certain dietary restrictions, you're always accommodated. It's not like you're going to be left out just because you don't eat something. My favorite memory was at the program was getting to know the patients on a personal level. Like I said before, the people here are very friendly and they will want to get to know you, and at the clinic within 2 weeks a lot of the patients come every day, because some people have things that they have to be taken care of every day, especially the diabetic patients, and getting to know them on a personal level was something that you would never experience back where I'm from, because people are seen as more of a number. Over here they're seen as a patient and a person. So I think that was the thing that touched my heart a bit, just getting to know patients on a personal level instead of just thinking of them as a patient. My favorite memory of the country was the people that I met and the places that I went, because a lot of the places have such a beautiful aspect to them, which I recommend anybody that comes to go to Rio Maria. It's in the middle of nowhere in the mountain, and it's one of the most beautiful places that I've ever seen. A broader view is always there to contact me and answer me as soon as possible. So if you ever feel uncomfortable, if you have a problem, they will respond to you within minutes or within at least the hour. I was never disappointed with how they were talking to me. I am willing to speak to other volunteers, and I found a broader view through Google.